Hello everyone. Welcome to our channel Krityan Medical Coding Academy, number one medical coding institute. Many of the professional or CPC certified coders, are facing a problems like how to use or when to use a modifier 78 and 79. So today the topic will be discussing on how to use modifier 78 and modifier 79 with the clinical examples. Let's begin modifier 78 and modifier 79. So if you see here, before going to discuss on modifier 78 and modifier 79, we'll see what do you mean by global surgical package. What do you mean by global surgical package? Uh, See, whatever the surgeries or happen, right? So after surgery, like there will be a follow-up. In a simple way, I can tell you is the post-operative visits and which is a global surgical package. So let's see what is exactly the global surgical package. Here you can see what is global surgical package. Surgical global days. It is also called as a global period, and it is set of number of days following surgery. Number of days following surgery, like during which all routine or related follow-up care is bundled into the original surgical payment. And this is what surgical global surgical package, or in a terms call it as a global period only. Global period. It's a one of the important question in interviews. They might ask you, what do you mean by global surgical package? So you can say that number of days following surgery. So this includes, routine visits or follow-up care. All are bundled into single payment, and that's a original surgical payment. And the global period days, the length of the global period, it depends on the complexity of the procedure and the complexity of the procedure. If you see here, the global days, 0 days, 10 days, and 90 days. 0 days is generally it's a minor procedures or endoscopic or diagnostic all comes under 0 days global period, and this includes services on the day of the procedure itself only. And it that means it does not require any uh, post operative follow-ups only. So those are considered as a 0 days global days. And the 10 days global period is nothing but here minor surgeries. And this includes the day of surgery and the 10 days immediately following the surgery. And the total days for global period for 10 days is 11 days only. Okay, total is 11 days. The day of the surgery will be counted as one. The next 10 days will be counted. So total it is 11 days only. And 90 days global period, it's mainly for major surgeries, and this includes 1 day before surgery. 1 day before surgery, we call it as a preoperative visit only, and the day of surgery and 90 days after surgery. Total 92 days only. So total 92 days. For major surgeries, preoperative visit as well as the day surgery and the day like after surgery the 90 days only, so total 92 days global period. And what are included and what is not included here, you can see routine follow-up visits, post-operative care, and even pain management. These are the few examples what are included in the global surgical package. Then what is not included means whatever the unrelated procedures or staged procedures or complications, these are not included, and we can code this separately by adding a modifier 78 or 79. Of course, there is a modifier 58 also, but in today's uh, topic, we are only discussing about the modifier 78 and 79. In the next video, I'm going to explain you about the modifier 58 only. So let's begin with the examples of modifier 78 and 79. Here you can see modifier 78 is what? This is an unplanned return to the operating room for a related procedure. Unplanned return to the operating room for a related procedure. Mainly this may expect, complications only, which is unexpected complications. And that's the same surgical site. Again, they are doing, surgeries for that same original surgical site. And for this scenario, the global period does not restart only. So global period, I told you just now, right? The global period are 0 days, 10 days, and 90 days. So this is not applicable when you are applying the modifier 78 only, because this is a related procedure. So for example, here you can see a physician performs a C-section only, like which is a cesarean section. Imagine this is having a 90 days global period. So after the day, the patient is returned to the operating room for post-surgical bleeding only. So which is a hemorrhages happened. So for this again they did a surgery. So this is originally related to the same surgery, right? Which is same surgical site. So for this the global days is not applicable only. For which one the stop the post-surgical bleeding. If you see another scenario, 10 days after a total knee replacement. So there was a total knee replacement surgery done, and after 10 days, what happened? The patient develops a the surgical site infection and must return to the operating room for IND procedure. So this is what the same surgical site, the same surgical site got an infection. Then the patient came back to the operating room for what? Incision and drainage only. So we will code that incision and drainage procedure and we'll give the modifier 78. The 78 modifier indicates the patient is already in the post-operative global period and he came back to the operating room for such complications and unexpected complications. If you see another scenario, 8 days after a partial colectomy, the patient is returned to the operating room for secondary suturing of the abdominal wall due to wound adhesion. So same original site, we can use the modifier 78. And following it up, um, like this is a prostate surgery and the patient develops a severe bleeding that cannot be managed at the bedside. They are rushed back to the operating room for cystourethroskopy control of hemorrhage. So this is same related to the surgical site only now. So for this also, we will code cystourethroskopy control of hemorrhage and give the modifier 78. And a patient receives a bypass graft 3 days later. The graft leaks, requiring an unplanned return to the operating room for a repair. So which is same related vaginal site, right? It's the same surgical site. So this one also we can use the modifier 78. And here also, after abdominal surgery, the patient develops a deep abscess. The surgeon must take the patient back to the operating room for extensive incision and drainage. And same surgical site, use the modifier 78. These are the key words you need to remember when if you are going to use a 78 modifier. One is unexpected complications and other one is a same surgical site. So we can use 78 modifier, which is nothing but unplanned return to the operating room for a related procedure and the original procedure. Let's see modifier 79 here. This is about a new unrelated procedure and that is performed during the post-operative period. The post-operative period may be 10 days or 90 days. So within that post-operative period, if the person is coming for another new procedure, we can use modifier 79. So this is completely unrelated to the original site and completely unrelated to the original site. So which is different surgical site and for this one, global period restarts only. So whatever the new procedure performing, right? So again, that one, the global period starts based on the complexity of the procedure. It may be having 10 days coverage, might be a 90 days global period. And you can see here the scenarios. 2 weeks after a patient has a gallbladder surgery, the same physician removes a benign mole from the patient's shoulder in the office. This is a different procedure, but the patient is in the post-operative period. Yes, we will code this procedure and give the modifier 79 because this is unrelated to the original procedure and during the post-operative period only. Next, a patient is in the global period for a cataract extraction in the right eye, and 2 weeks later, the surgeon performs a cataract extraction on the left eye. So during, again, it is same story, which is during the global period, the patient came for another eye procedure, so which is unrelated, different surgical site. Simple, same surgical site is 78 and a different surgical site is 79. And a physician performs exploratory surgery on a forearm lump while still in the global period. The patient returns for the removal of an unrelated fibroma on the leg. You can see here, this is a forearm and this is a leg, right? Completely different surgical site. We can use 79 modifier. A surgeon performs cataract surgery on the right eye while still in the 90-day global period. The patient returns for cataract surgery on the left eye. So based on different surgical site, we can use modifier 79 for this procedure. A patient in the global period for surgically repaired fractured femur during recovery, the experience a sudden unrelated acute appendicitis and the same surgeon performs an appendectomy only. So the first procedure is a fracture repair, right? So during the recovery only, he again got some appendicitis. He is suffering with appendicitis. The same surgeon performs an appendectomy. Yes, I can code this appendectomy procedure and we will give the modifier 79. And 2 weeks after a major surgical excision on the back, the patient returns to have an unrelated bothersome skin tag removed from their neck candy. So, which is again different surgical site. You use the modifier 79. 79 modifier. And I hope you understood, right? So, we are discussed about like we have discussed on modifier 78 and 79. So, please go through these scenarios. If you have still any doubts or any clarification, you always reach out to the below number and we will help you out on the clarifications. So thank you, everyone. Um, Stay tuned for more coding knowledge and please kindly subscribe and share to your friends. And this is our address. You can see here, like you can reach out to this number. We will guide you out. And we are providing online classes and offline live classes. So thanks for watching. Uh, Please stay tuned and we'll post the next video and please like, share and subscribe.